Okay, hello everyone, and thank you so much for watching. My name is Kat Nichols, and I'm a content creator at Happyful, and I'm joined today by psychotherapist Carol-Anne Cowie to talk about this year's World Mental Health Day theme, which is inequality in mental health. So, Carol-Anne, to start with, could you please introduce yourself and tell us a bit more about the work that you do?
Yeah, absolutely. I'm Carol-Anne Cowie. I'm a psychotherapist based in Aberdeen in Scotland. I'm an accredited member of the BACP, and I also have my own private practice, Mind Health Matters Limited. I work with individuals and I also work with organisations as an employee assistance provider. In my spare time, I volunteer with a local charity, Cairns Counselling, and I'm also an online tutor for counselling skills with the University of Aberdeen.
Oh, wow, that's amazing. That's so interesting that you do the tutoring as well. That's really cool. So this year's World Mental Health Day theme, let's talk about it a little bit, because every year the World Federation for Mental Health sets a different theme. And this year it's all about inequality in mental health. So if I read through a little bit about what the World Federation for Mental Health says about this year's theme, and then we can get into the discussion about it. So this is what they say. 2020 highlighted inequalities due to race and ethnicity, sexual orientation and gender identity, and the lack of respect for human rights in many countries, including for people living with mental health conditions. Such inequalities have an impact on people's mental health. The theme chosen for 2021 will highlight that access to mental health services remains unequal, with between 75 to 95% of people with mental disorders in low and middle income countries unable to access mental health services at all, and access in high income countries is not much better. Okay, so obviously this is a really big topic and it's a really important one that I'm glad that they're highlighting this year. So as a counsellor working in the mental health industry, could you tell us a bit more about your perspective on the inequalities that are happening and perhaps how these manifest for you?
Yeah, well, for me personally, because I work with a charity and also in private practice, I kind of have the perspective, if you like, of, the kind of people that can afford to pay for mental health care and the people that obviously are struggling because they're from poorer backgrounds, because they have an employment and they face the challenges there. So in terms of access, just as you said, there are huge barriers to accessing mental health care, particularly if you come from a marginalised or a disadvantaged community. And exactly as you said, there's barriers for people of colour, there's barriers for LGBTQ people, there's also barriers for disabled people. And one of the things I've personally experienced working with an individual with a disability, so much emphasis is placed on their physical care needs, but very little on their mental health care needs. It's very neglected in my personal experience. I also see actually inequalities manifest within the counselling community. Again, within my experience, counselling is predominantly white middle class people. So counsellors are coming from a place of privilege. And I feel like there's so much more that needs to be done to actually have a diverse range of mental health professionals so that people can actually access a service where they will feel heard and understood rather than marginalised and discriminated against.
Absolutely, I can imagine that's a real problem for people, seeking someone who understands what they're going through, not just mentally, but through societal oppression and things like that. So I can totally understand that. So as you said, it's clear that certain groups find it more difficult accessing support than others. And in your opinion, what do you think it's going to take to bring equity for mental health support? And are you seeing any positive changes happening at all?
I think equity has to come. It's a really kind of grassroots fundamental change that's needed from government, to drive through these changes, because it's a very kind of societal issue. The issues of the discrimination and marginalisation of groups of people, that needs to move before inequalities can level up, so to speak. So yeah, I think that there are changes happening, most certainly. For me, I see changes within. There's much more investment now in mental health care for young people. And the course I'm teaching online with the University of Aberdeen, I'm teaching people who work in education. So they're learning counselling skills so that they can be more empathic listeners and also more receptive and open to seeing mental health issues in children and, you know, being able to refer on rather than feeling out of their depth perhaps and not having the capacity to cope with it. So that there's change there. And actually the government, I beg your pardon, the BACP and other organisations this month are lobbying the government for mental health care listening hubs for young people. So change is coming, I think, but it's going to take a lot.
Oh, that's so interesting. Where could people find out a bit more about that from BACP? Is it on the website?
It is on their website, yes. Yeah, it's part of their news. I do beg your pardon, you can probably hear a helicopter going by.
Oh, that's so interesting. I think you're right. I think going from the kind of ground up and supporting young people before, because so many mental health conditions do kind of start in kind of childhood and adolescence. Is that right?
Absolutely. And I think if children are given appropriate mental health care, they can learn the skills, they can learn resilience, and they can learn actually life skills so that going forward as adults, when they do encounter challenge, they'll be able to cope with it better because they've learned these skills from an early age.
Yeah, absolutely. And you also mentioned about how the mental health industry needs to become more diverse. And I think I'm seeing some of that a little bit more, seeing places like, I think it's Black Minds Matter, organizations starting up so that you can find the right person for you. And yeah, it's great seeing that kind of coming about. So as we said, a lot of the work needs to come from governments, it needs to come from those in power. But is there anything you think members of the public can do to kind of support this change and encourage and campaign for equality?
Yeah, I was kind of giving this a lot of thought. I think in terms of things like joining the mental health campaigns from the World Health Organization, from the Mental Health Association, you know, there's lots of organizations online they have campaigns that you can join. I think as well, it would be valuable to lobby your MP, particularly if you feel like your own community is you know, being bypassed, largely ignored and marginalized. Lobby your MP because, you know, they should be actually acting on your behalf in these instances. But I also think there's a lot to be said for community ties and strong roots within a community. And I feel that, you know, if that's there, if that's established, then they can identify people that are perhaps vulnerable, who would be susceptible to mental health issues, and perhaps even just reaching out for a physical visit or, you know, a socially distanced online call, things like that. People can help each other within communities.
Yeah, absolutely. I think that's so important because something we need to remember is these inequalities have such an impact on mental health. And this was another question I had for you as well, was can you explain how this inequality in these systems can actually affect people's mental health? And what are the consequences, do you think, if we don't make these changes, if we don't start supporting and campaigning for this?
Yeah. Well, I mean, the inequalities affect mental health because people don't feel heard. They don't feel understood. They feel they're alone with their problems. You get that stigma and that shame that's associated with it. And they feel that for them, you know, whether they're being discriminated on for their culture, you know, for disability or whatever it is, that will impact negatively on their mental health and make it very hard for them to cope. The long-term impact of that is that, well, today, in fact, on the news, the Royal College of Nursing reported that they've had a massive increase in nurses off sick with depression, stress, anxiety. So it's not COVID, as you'd imagine, in the last year, it is mental health related issues. So again, this is impacting on the NHS. They can't get enough staff to work when they're already short-staffed anyway. So broadly, society will suffer because actually people will struggle so much with their mental health that it'll be really difficult to actually lead a mentally healthy, functional, normal life.
Absolutely. That's so interesting. I think that was actually all I had for my questions. Is there anything else that you wanted to talk about whilst we're together on this subject to bring up? Obviously, you are the expert here, you work in this industry. It'd be great to hear anything else you have on this.
Yeah, I think it's just, in terms of the changes that need to come about, it definitely needs to come from government, but also I feel as if there needs to be more of an acknowledgement of the importance of mental health care professionals like counsellors, like psychotherapists, because currently we're seen very much as a sort of marginalised group, if you like, and it's one of the only industries I've ever encountered where most people are expected to work for free. So, you know, you have to be highly experienced and educated, but paid positions are actually few and far between, and people are expected to work for free. Now, obviously, if you're coming then from a position where you need to work to support your family, you can't become a counsellor or psychotherapist because you simply can't support them. There's no living wage, or very few jobs with living wages. So I think fundamental change there could help people that are currently, you know, the inequalities there in recruiting people into that industry. I think something needs to be done there.
Yeah, that is a really good point, because there is a definite barrier to access there. I know I've done some training in coaching, and even to get qualifications and training on that, it's very, very expensive. And I think, as you say, it's something that's not necessarily discussed, and you are expected to work for free and do all of this. So yeah, that would be really great if that barrier could be lowered, so that more people from different and diverse backgrounds could come into this arena. And do you have any thoughts on people that might not be able to access private counselling because they can't afford it? Obviously, there's a lot of issues with NHS waiting times at the moment. Is there anything else people can do to get support that they need if they can't access private counselling?
Yeah, there's lots and lots of support online. And you can even just Googling mental health care in my area. There are lots of charities. And admittedly, the charities are like the NHS. They're very overloaded. They have long waiting lists. There's no question of that. But there's so much self-help online. So just, you know, Google mental health in your area, or just mental health generally. Even just Google anxiety, stress, depression. Why am I feeling this way? There's lots and lots of free help on there. Admittedly, this will be difficult for people who don't have access to the internet, but then perhaps I know there are certainly telephone lines and so forth, so you can find out from your GP, you know, what the free provision there is out there.
Absolutely. I think that's one of the reasons why we developed our Happyful app, is because we wanted a free space for people to be able to either connect with professional counsellors if they are able to, but we also list lots of peer support groups around the UK, so you can access that. And that is also another reason why we have our magazine option for free as well, as an e-magazine. So everyone has access to the content and the information, which is a lot of self-help. And I know it's something as a company we're looking to bridge the gap a little bit further if we can, and support with like looking at advertising courses and workshops and things like that can support people, because there is definitely a gap there. And I think the more that we can do to bridge that is brilliant. Okay, thank you so much, Carol-Anne, for coming and sharing your wisdom. Could you please let everyone know where they can connect with you online?
Yes, certainly. I have my own website, www.mindhealthmatters.co.uk. You can email me at mindhealthmatters@protonmail.com, and you can also find me on the Counselling Directory website and the BACP register.
Perfect, thank you so much. So if anyone watching has got any questions, we do have some time. So yeah, please do bring your questions our way. What do you think could be done to encourage and support a broader range of people in becoming counsellors or mental health professionals to have better representation within professionals offering help?
Great question. This is a subject dear to my heart. I feel as though that there needs to be some funding in place to actually fund people through the training process, you know, to support them through. For example, nurses now, when they do a nursing degree, they're paid an amount each year to undergo their training. I don't understand why mental health care isn't given this same type of treatment, and you know, that could open the doors to so many people if they could get a basic living income to see them through their training. And then again, there needs to also be the paid opportunities at the end of that training, because even ongoing in counselling and psychotherapy, your ongoing costs each year just to practice. You know, you have your membership of bodies like the BACP, and you have ongoing CPD, which is very costly. So you do need an income, and absolutely, I feel like there should be funding available so that it opens access up to everyone, because why shouldn't it? Why should people be excluded just because they can't afford to go through that process?
Absolutely, and there must be so many people who have the natural kind of skills and abilities who would be so good if they were just given the opportunity. Oh, that's been so interesting. Thank you so much for sharing all of this with us. And thank you so much everyone for watching. And if you are looking to learn more about mental health or connect with a professional, as we said earlier, we have got our Happy For app. And of course, Carol-Anne is on the directory, which is counselling-directory.org.uk. And yeah, hopefully we can all start to become more aware of all these subjects and start doing more and making a real difference. So thank you for your time today.